We're doing it. All right. Good afternoon. Thank you for being here. A small but mighty crowd for a very important topic. And thank you, Loretta, for being here online, and Kathy. Um, I'm so pleased to have a special guest today, who is I think, the go-to person on food security and Medicaid issues here in Illinois. And so this is Nia Kelly. She spends her days with Chicago Coalition to End Homelessness. And I am Rachel Ruttenberg, the Deputy Committeeperson here at the Democratic Party of Evanston. And this is our second policy salon. The first one we did a month ago. This is a monthly recurrence. And the last one we did was on ranked choice voting, and it is available on our YouTube page, the recording of that. But it was a very interesting conversation with two experts on that topic. So today we're shifting gears entirely to talk about these really important social safety net programs. So with that, welcome, Nia.
And thank you so much, Rachel. Oh, thank you. You're so sweet. Thank you. Thank you, Rachel. And thank you, Kathy, for allowing me to be here today. I'm a former Evanstonian. But when I went to law school, I had to move across the border because I needed to be able to take the red line and be home. Love the purple line though. There is nothing sadder than like coming into Howard and watching the purple line leave the station and you just want to get home. But I love it here. Someone says that I spend so much time in Evanston, I might as well live here, but I've already bought in Chicago. Anyway, that is not why I'm here. Thank you all for being here on a Sunday. As Rachel said, my name is Nia, and I'm over at the Chicago Coalition to End Homelessness. Despite our name being Chicago, we are a statewide organization that works on housing and homelessness issues alongside poverty-related issues. In our work, we believe that housing is a human right, but we also believe that we have to take a holistic approach to talking about housing, because even if we are able to get everyone housed, if they don't have food security, if they don't have access to social services, if they don't have access to public transit, then will they be able to keep their housing? And so when we're thinking about housing, we're thinking of it in all of these factors and all of these different entities, including childcare, healthcare, food benefits, access to education. And so I have been with the organization for 11 years. And over the last couple of years since Trump won, as we call it, I know, we have been a part of this space called Protect Our Care. And what Protect Our Care is, so we knew that the Republicans, and we are a nonpartisan organization, but it is what it is when we are talking about like facts. Yes, when the Republicans were campaigning during Trump won, they talked about attacking Obamacare. They talked about cutting access to social safety net programs. And so when we saw them coming in, we, alongside other organizations like Heartland Alliance, RIP, we miss you, alongside AIDS Foundation, Citizen Action, EverThrive, RIP, Shriver Center, we all got together and said, hey, we need to be making sure in Illinois that we are doing everything that we can, both with our federal delegation, so our U.S. reps and our senators, as well as with our state legislators and local leaders, to ensure that we are pushing to ensure that people are able to keep their health care here in Illinois. Under Trump 1, I think we did a really great job. Like, we were able to hold the line. I think most people remember when, Senator McCain came on the floor and he did the big, and that was the end in terms of the fight around Obamacare. Obamacare has been around at this point for what, 16 years since 2000. Oh yeah, 16 years. And Republicans have never been able to say they want to replace it with something. They've always said we want to replace it, but they have never told us what their plan is in terms of replacing it. When Trump 2 happened in November of 2024, we all took a day and said, I cannot believe this is happening again. But we knew that we needed to get back up. And we said, Protect Our Care needs to reorganize and we need to be out there. So we have been in our current form for the last 2 years. And yes, you want to ask a question.
Nice, obviously very used to this. So Protect Our Care is this big organization. It's now been through 2 Trump terms, or we're in the second with this coalition of advocates. Yes. Tell us, though, about Save Our SNAP.
Yeah. So Save Our SNAP is a newer coalition, but made up of similar-minded individuals. Greater Chicago Food Depository, again, another organization with Chicago in its name, but a statewide organization. And it is what it is. What the name of the organization is of Save Our SNAP is what we're attempting to do. So SNAP is Supplemental Nutrition Assistance Program. It is the food access. Sometimes people call it LINK or they call it EBT, but it is a way for people to be able to remain food stable and making sure that folks are able to make sure that they're feeding themselves and their family. And so with everything that's been going on again with the federal government and what happened with HR 1, and I know I don't want to, I want to talk in terms that folks understand. So if I am talking too much at a low level or a high level, please stop me. But with HR 1, which some people last summer called, I hate saying it, the big beautiful bill, that is HR 1. That is what we were attempting to fight against as soon as Trump 2 administration started. They stated, we want to make changes to Medicaid. We want to make changes to SNAP. And with those changes, they started with getting folks at the federal level at the table and said, what can we cut? Because we want to give a tax cut to those at the top. And in order for us to do that, we have to cut. They will tell you today and say, one thing has to do, nothing, what happened at the top has nothing to do at the bottom. It's simply not the case. It is literally 1-to-1 of what they cut and what they gave in tax cuts to those at the top.
Thank you. That's very poignant. Backing up a little bit, can you provide for us a little bit of the basics of what SNAP is and what it provides and what Medicaid is and what it provides? I think that would be a helpful, foundation. Yeah.
Absolutely. So as I said, SNAP is, supplemental nutrition. It allows for someone to be able to get, based on a formula that has been set by the federal government, based on 1 person, 2 people, 3-person household, for them to get a set number or set dollar amount on this card monthly. It is not this, as someone who used to love Harry Potter a lot, it is not this like everlasting, if you read book 7, when you touch the thing and then 10 things pop out. That is not what it is. Once someone gets, say their monthly allotment is $150 to go to the grocery store, and for the month, that is what they are meant to have in order to supplement their nutrition. And for some people, this is what their nutrition is. Like, this is what they're going to be getting for the month. So when people say, oh, they're going and they're buying lobsters and they're buying steak, if they were doing that, raise your hand if you went to the grocery store this week. And if you had $150 to use for groceries, it probably would have lasted you a week instead of a month. Like, I got my groceries delivered this morning, and I said to myself, I really cannot believe this is where we are as a society. Like, you get 3 bags, and they're like, hey, yeah, so that was $300. Thank you so much for coming. But that SNAP allows for families to be able to go to the grocery store, as well as a couple of years ago, a program started where people can take it to farmers markets. But we also know that there are some people who live in food deserts, And in those spaces, they are often going to convenience stores or corner stores and purchasing things. You've heard people say, well, people shouldn't be able to buy junk food or sugary snacks or pop or Coke with their snack. I'll come back to that. Let's parking lot that for a second. But switching to Medicaid, Medicaid is a way that we ensure that people have access to health care in this country. And it's not only that traditional, okay, you go to the doctor, it's also when people have children who may be exhibiting they're not hitting certain milestones. It's a way for them to be able to get early intervention services. So it may be occupational therapy, it may be speech therapy. It allows all kids, if you're thinking about health insurance for children between the ages of birth till 17 and 364 days, or it is when we're thinking about pregnant people and making sure that they have access to health care while they are pregnant. It is ways for us to ensure that. I will also say that both SNAP and Medicaid are both not only supplement for poor people, but it supplements all of us. We all get to go to the doctor. And even though the prices, I had to fight with my insurance company the other day because Northwestern wants their money on time. But we ensure that our prices stay down for folks who are on the traditional market, that our prices stay down because Medicaid is supplementing the way that we are able to go to the doctor. So when they pull Medicaid funding, it impacts us because it may mean that our doctor it's no longer profitable for our doctors to stay in certain spaces because they're not getting a 1-for-1 or 0.5 to 1 pay return on things. So when you see rural hospitals closing or when you see safety net hospitals closing, it's not because people who are on the traditional market are stopping going to the doctor. It's that those folks who are at the bottom are no longer able to go to see the doctor.
Do you know, kind of off the top of your head, an estimate of how much you could have in resources and still be eligible for these programs?
Yeah, it is really difficult for people to qualify for Medicaid or SNAP. So you have to be, and I don't want to misspeak, but I believe that you have to be at 150% of the federal poverty line. And for often that is someone making upwards of like $21,000 per year. And that is how people are able, like those families are eligible. If they have children, obviously that is factored. It's a formula in which that we're looking at in terms of qualification, but it is extremely low.
I'm going to pause for a second and see if we have any questions about the two programs, about SNAP or Medicaid, who's eligible, how they operate. Anybody have any follow-up questions? We like this to be a bit of a discussion.
Mm-hmm. Does a wonderful sketch.
Mm-hmm.
And yet she never thought she would miss Baby Trump.
What is Baby Trump?
You know, baby, his first.
The first term.
Oh, his first term. There were a lot of more guardrails. Oh, yes, yes.
Yeah.
Yes.
We're getting a recommendation to see the Wanda Sachs stand up. Which is, by the way, the kind of question you get or comment you get at a party. I love that.
We had a lot of guardrails under the first. Like you had people, they were not kind individuals, but they also had some sort of loyalty, it seemed, to process. Like they wanted to dismantle things. I think the second term has allowed them to remove those guardrails or not to bring those folks back. And so we are seeing a lot of things when it's like, you can't do that. Like people, like you will, I think at the beginning of the second term, they said, oh, the Supreme Court will never let that go by, or Congress will never let that happen. And what we have seen is that oftentimes the judiciary does try to stop things, but then you see, we're at the end of June, which is when we get some of the biggest Supreme Court cases. So, we saw on Friday or Thursday the stuff with Haitian and Syrian refugees, which is horrible. And we are at the anniversary of Dobbs and the anniversary of the Grants Pass v. Johnson decision. We are at a point where, we want to hold our judiciary to a certain standard, but we also know that when we get to the top, when we're talking about the Supreme Court, we're in a very precarious and hard place.
What is your sense of support from either Evanston or statewide for
great.
Medicaid?
So the question is, what is the support from Evanston or Illinois for Medicaid and SNAP?
Yeah. So thank you for that question, because it really brings us into why Protect Our Care exists and what we've been doing. So as we saw everything that was happening last year, and we saw it all start in February of last year, and then the 1-year anniversary of HR 1 being signed is this Saturday. He signed it on July 4th last year. And so what we've been doing as both coalitions has been a couple of pockets. One, we've been doing education. People will oftentimes read something but not really get into the crux of it. And so there is this fear of, I'm going to lose my benefits. So we want to make sure people understand, if there's a way for them not to lose their benefits, we want to make sure that we're getting them in front of their public aid office or some sort of social service organization to help them maneuver to keep their benefits. What we've also been doing is, a lot of people think that our state and our federal legislators talk to each other. They really don't. And so our work has really been, last year, we were making sure that, obviously, Illinois is a very blue state. Republicans don't have a lot of control here. And so one thing we try to empower Republicans to do is to talk to the 3 members of our delegation to say, hey, he's your neighbor. Please go and tell him that what he's attempting to do is bad. So talking to high members in the Republican state party to go and talk to their counterparts at the federal level, but also teaching the Democrats, hey, these are the things that are what's happening at the federal level. We don't have power there, but we are in a trifecta. We have the House, the Senate, and the governor's office in the state. These are the things that you all should be working on. And so we know that people who are undocumented, not only undocumented, but now people who are documented, and where Rachel used to work at Heartland Alliance, they passed this amazing piece of legislation maybe 10 years ago that worked on people who were in the middle of their process. So they may have been, they are victims of trafficking or of torture. They are seeking asylum in the United States, making sure that we had a state-run program that allowed them to get, because they can't work because they don't have the correct paper status, but making sure that we had a state-run program that allowed them, it's called the VTTC program, and allowed them to be able to get a state companion SNAP or state companion TANF and access to healthcare. You want to ask? And then I was going to also say, so making sure that we're putting money into that. As we saw people being removed from the SNAP rolls here in Illinois, in last year's budget, the governor created a bridge fund. And within that bridge fund, in our state budget, he said, this is when things happen at the federal level. One, we're going to give money to the Attorney General's office so we can sue, baby, sue. And Illinois has been a leader in terms of the way that we have engaged with other states to ensure that anytime there's an opportunity for us to sue, our Attorney General has stepped up alongside advocacy organizations and legal aid offices with other like-minded states. And then last thing I'll say before I hand it over is that in this state budget, they included $70 million to go towards people who are going to be removed from SNAP. And it's going to be a one-time payment, but it is an opportunity for people who are being removed from SNAP to be able to access 3 months of assistance so that people are not going hungry. We know that the SNAP dollar goes we always think about food banks. Well, people should just go to food banks. There are so many barriers to people getting to food banks. I work alongside impacted people. And one of the women that I work with, she's not only taking care of her grandchildren, but now she's taking care of two of her great grandchildren. And she is 71. She knows where every food bank in her community is. She does not have a car. She is prone to be sick, but on Monday, she has to take one child to speech therapy on Tuesday, and then she has to take another child to occupational therapy on Thursday. On Monday, Wednesday, and Friday, she is at her food banks making sure that she is able to get what she needs. She is not eligible for increased SNAP because those kids are in foster care. And so she has to take on the responsibility. She gets like $120 a month in SNAP. And then she is traveling around her community looking for food banks so that she can feed the children that are in her household. I told her, do not take it. If any of your children or your grandchildren knock on your door and say they need a place for their children to go, it is closed. You cannot bring any more children into this house. But she's like, I don't want them to go into the system. True, but she has a schedule now of like going to all of these food banks so that she can make sure that every child in her house has food on the table.
That's really powerful. Thank you. So, your question could have meant a couple different things in my mind, but I also wondered if this might be a good excuse or a good opportunity for you to share a little bit more about your job. Yeah. What is it that you do? And also, we may have a trifecta of Democrats, but clearly there are a lot of challenges and a lot of work to do. And so what is some of that?
Yeah. So in doing my job, I am going down and I'm talking to legislators. So for 6 months out of the year, I'm in Springfield, Monday through Thursday. And it is an opportunity for us to have conversations. Like I said, our federal delegation doesn't talk to our state delegation. And so we have hosted teach-ins with them. We have hosted subject matter hearings. One of my favorite things that I have done over this last year was first of all, Republicans had been telling us that we had been telling them that the sky was falling and that we didn't know what we were talking about. So we hosted a subject matter hearing in our Health and Human Services Appropriations Committee. And the way that I put that panel together, I had someone who was on SNAP. I had someone who was a grocery store owner. For every dollar that is spent in a grocery store, that grocery store in SNAP, they get $1.50 back. They're able to hire people. They're able to supplement in terms of like putting things on sale because, hey, they got that. That's a guaranteed SNAP dollar that is going to be coming into them. People who are on SNAP also have other income, and so like sometimes other income, and so that person may be spending that as well. When $150 doesn't, go far, they're bringing in other dollars as well. And so we had a grocery store owner, we had a farmer testify and talk about how what was happening at the federal level is impacting him in terms of, I don't know if people remember, but the federal government used to buy a lot of food from farmers and supplement because welfare also goes to farmers in terms of how, like, when you think about those folks who are dairy farmers or soybean farmers and what we're seeing with Brazil and China in terms of soybeans and how like soybean farmers in Illinois are going out real bad. So we also had the Illinois Merchants Association testify. We had a veteran testify. And when I tell you the Republicans who were on that committee, shut up. They had nothing to say at that point. They said, after they told us that we were lying and that we didn't know what we were talking about, no, we bring your own constituents to you, and your constituents are saying that you all are actually killing them. And so doing some of that work is important. Also teaching them, like, one of the talking points that they got from on high is that, oh, there's so much fraud happening. And we saw what happened in Minnesota, and some of the stuff that's happening here in Illinois is they think that an error rate means fraud. And so if you haven't heard the phrase error rate, within government, there's going to be, like, if you're talking about this amount of money, you are going to see mistakes happen. And we had a way to determine our error rate until Trump won, where he changed the way we talked about the error rate. And so every state's error rate doubled because they included all of these things that just didn't make any sense. So our error rate has gone up, but it does not mean that that is fraud. It means that when someone was doing their application, that person, I work with another person who is not only doing their own, they have their aunt, they have their mother, and they have their father, and then they have their disabled child. And so she's doing the applications for all of these people. If she mistakes, like, you're supposed to, like, if you're doing your own taxes, like, I remember when I filled out my form to start working, and I really wanted to call my mom and be like, am I supposed to just say that I have one dependent? Like, am I a dependent? Is like if I had a turtle, would that be a dependent? Like, people make mistakes on these forms. So when they make mistakes, that it goes into our error rate. That means that you may be overpaid, but often it means you're underpaid as well because you're not putting the right number. It means that the person who was entering it into the system may have made a mistake. And often when we're thinking about fraud, when they investigate it, oftentimes, do you all know what skimming is? So skimming is, if it can happen with SNAP, and it can happen with our regular credit card. We go to fill our car with gas, and we put in our debit card, but there's a machine that's been attached to it. And so now we go home and we get a notice from Chase being like, hey, your account has been emptied. We saw a lot of that, and we've been seeing a lot of that since 2020 when folks were getting additional benefits. And so we have found out that it is oftentimes not the fault of the person who is applying, but it's sometimes businesses put those skimmers on. Sometimes random people put those skimmers, they come in and they put those skimmers on. That's fraud. The error rate has nothing to do with that. So also teaching the people in Springfield what these words mean, because they hear them on the news. And they may go Google and they don't really understand. So our job is also to, like, there's a lot of issues that our legislators have to, like, wade through. Our job is also to make sure that they understand. And last thing I'll say, and I'll hand it back to you, is having Leader Robin Gable in Springfield has been so important. She is one of the chief budgeteers in the House, and has been someone that has really stepped up and, like, wants to learn and wants to understand these things. And so when we step up and we say, hey, Leader Gable, can we talk to you about these issues? She understands the constraints that the state is under, because the state is broke. But she also wants to find a way for, if there is additional funding and additional ways for us to find pots of money that we can put into these things, she is always willing and able to listen.
Thank you. That makes a lot of sense. I also want to just say that one of the things I've heard you say before is that your job is to make sure that people know that everyone is a human. Everyone is a human, right?
Yeah.
And so that, to me, is a really important role that you play.
And I didn't realize that when I started this job, I didn't think my job was going to be easy. I didn't think that I was going to be able to, like, if my job was easy, I wouldn't need to have it. But my role as an advocate around people who are experiencing poverty, it is sometimes really jarring. The conversations that I have to have in Springfield about how people want to police people who are living in poverty. It is this, we want to hyper surveil them. And we see poverty as a moral failing and not an individual failing, and not a systemic issue. And I say that not only to the legislators and the people in power that I talk to, but also the people themselves. Often people say I failed, and it's, I, within my job as director of equity or director of state legislative policy, I also am our equity and transformation director at my job. And so I often have a time to sit down with people who are impacted, and I have the chance to talk to them about how we got here today. So today is what, June 28th, 2026. It is not a mistake that we have such a wealth gap in this country. It is not by happenstance. It has been something that has been rooted in this individualism that people feel that it is your personal responsibility, as opposed to it is us as a community to stand up and make sure that everyone has access to things. And so when I go and I speak in Springfield, or when I'm talking to a Lyft driver, or I'm talking to my family or to my friends, I often have to take people out of this individual idea of why someone is experiencing something, and then bring it into this broader understanding of our government has set up people in such a way that it doesn't often allow people to move out. Like when people are like, what about Oprah? What about Obama? And I'm like, are you all, is everything okay up here? It is the conversation of, yes, those people are outliers. The way we have set up systems is racist. And so when you look at like 1996 and you look at welfare reform, and you saw what Newt Gingrich and Bill Clinton did, when we look at how welfare was originally set up as like a widow's benefit, and we like that Black people didn't have access to it, or when we're thinking about how Social Security was set up in this country under FDR, who I talked to the Habitat for Humanity on Thursday, and I was like, if there is a heaven, Jimmy Carter's in it. Everybody else, don't think so. FDR, amazing president, and did amazing work, but had to work with the South. And the South said, you will not give benefits to farmhands and to maids. And so them getting access to Social Security and to other benefits, or the GI Bill, and all of those things that, Black people were not able to build wealth in this country. And so none of this is by happenstance. And so when my job is to humanize people, it feels gross, but if I'm not, I will do it because it needs to be done.
Anna, thank you. That was excellent.
I will personally say thank you. I spent time in my life when I was a young single mom. I stamp, I back then.
Yeah.
I used food stamps, and I
Yes.
used Medicaid. So those programs are so, I personally have experienced how helpful they can be, and want them to be around people. And I also really appreciate the observations that you're making about the way in which things are designed in a particular way, and the ramifications of that. And I especially appreciate how you're kind of, I haven't thought in Medicaid in that way before, like this ecosystem of the entire insurance industry in this country, and its role as kind of providing some kind of leveraging and leveling. And similarly with SNAP, that it allows these kinds of like college, a grocer, and being able to provide jobs. And I think those kinds of examples are so helpful in terms of people really not being able to think the folks over there, those people over there, those poor people over there, those all of the kind of narrative things that you're saying, that you have to actually go back down to the work of humanizing people in the public rhetoric. And so what are some of the challenges, like in what ways can we help or be more active, or the challenges that you face in terms of getting across that much more important message about how there are these ecosystems that we're all a part of, and that SNAP going away or Medicaid going away doesn't only harm people who've already been it's
Mhm.
really hard. But
Mayor.
has this impact on all of the rest of us who maybe don't need to use those programs right now. Maybe they're like me and
Yeah.
like
Mhm.
Yeah.
maybe at one point in my life, I hope not to have.
Exactly.
God forbid.
It could be
You know,
cyclical.
yeah.
Yeah.
So,
Yeah.
like what? How can we help?
Yeah.
So the question is that Medicaid and SNAP provide such a foundation to the other ecosystems that we're all a part of, that even if we're not directly participating in those programs, they are beneficial to us. And so how can we help make that case to people, but also help the challenges that Nye is going through?
Yeah, I think so. I talked about Leader Gable and how amazing she is. I think that sometimes when we have great leaders, we don't feel like we have to like reach out to them. And the people who are making the most noise are often the people who are in opposition to these ideas. And that so when they say, well, these constituents called me and they said that they hated this, I think it's also important for us when we elect great people or when we have great people who are in office that we're making sure that we're reaching out to them as well and say, I support Medicaid. I support our state finding a way to ensure that everyone has access to food and to healthcare. Bless you. I think also one thing that I talk about in terms of, I talked about that we are a super blue state. And I was talking to someone in the governor's office, and they once said, maybe we have too many Democrats down here because if you've been watching what's happening at the federal level, or particularly in New York over this last week in terms of different sects of the Democratic Party, even here in Illinois, we have a conservative wing that is known as the New Democrats. And they sometimes wrestle with the idea of we need to cut 5% across the board on all services. Like we are spending too much in the state. We need to cut human services or we need to cut services across the board. And when you say that, I say, when you say cut 5% across the board, do you understand that those are actual people? That is families. When we're saying we're going to cut 5% of emergency and transitional housing, that means that shelter is going to have to fire 5% of its workforce, and then they're not going to be able to take in 5% of those folks who needed their services. And so when we're thinking about that wing of the party and, Big Tent, it is making sure they also hear, like, we don't want to see that. We need to find ways in which, Rachel, the last time I was at an event where Rachel decided to stand up and say, hey, now you want to talk about revenue? And I said, here? But it's this responsibility of like, we don't want to go after those ultra wealthy folks. And we all, we have a flat tax here in Illinois. So I pay the same amount as, Governor Pritzker, me and him are very cool. He knows my name when he sees me. I think he just is really good at remembering names. But we pay the same tax structure, and I am not a billionaire. I make medium dollars at a nonprofit. And so it is like, how do we think about it's not, like cool to talk about, but how do we ensure that our legislators are going down to Springfield and understanding that it's like when we are making sure we're not cutting that 5%, that we're not doing it on the backs of the people that are in this room, that it is on the backs of those at the highest. And it's like, well, they will leave Illinois. I promise you, as someone who was I'm originally from Louisiana. People are not leaving Illinois like that. Yeah, we have snowbirds and we have people who go down to Florida or they go down to Arizona. But Illinois is kind of amazing. Like Chicago is an amazing place to be. You have your King Griffiths who take their money and they go away, but most people stay here. And when I first started this job, I was like, why is a baseball player so like responsible for? And then it turns out King Griffith is not the same as Ken Griffey Jr. But we learn. And so, yeah, I think that it is also making sure that we are reaching out to our legislators and letting them know when they're doing a good job. And if we think that they are not being progressive enough, that we're also making that call and saying, hey, I support you doing this work. We don't have to do it in an angry way, but I just want you to know that I support you doing this really hard thing.
Thank you. That's so helpful. Yes.
I think you're very astute.
Yeah.
And
words.
yes. Change the 5%.
Yeah. Yeah.
You had also begun to tell us when you decide strategically talk about class
Yeah.
poverty versus racism.
Yeah.
And race.
Oh, absolutely.
So, can you elaborate a little more? Can you talk about the how you win?
Okay, I don't know how to say that.
Yeah. Oh, I can. Yeah. Yes. So you have different conversations. The comment is around when do you have strategic conversations, whether you're talking about class or you're talking about race. I think that is so, yes. Springfield can be uncomfortable. Having hard conversations can be uncomfortable. My job is to be able to read when someone is ready to leave or when they don't want to talk to me anymore. And go to therapy. Yay, her. And so some of that is like pushing through that uncomfortableness, but other times it is like, how do I introduce this idea to someone? How do I get the door open? And once the door is open and they say, literally, you can have a seat, like sometimes it's like figurative, you can have a seat, and sometimes it's literally, I figure out, is this person ready to hear this? There are certain people who is just not something that they want to talk about. So how do I bring it to them? So when we have a subject matter hearing, am I going to ensure that someone who looks like them, someone that they would have a beer with, is sitting at that table? I'm doing that. Is it making sure, but I think we sometimes calling it's this idea of like, if you're talking about public benefits, one of the things we know is that when we look at it statistically, it's more white people than other people who are on public benefits. And so do we want to have someone who is from Effingham, Illinois, or we're looking at Embers, which is South Central Illinois, south of I-80? Do we want to get someone who they know that is their friend? Sometimes you will see legislators who care about an issue. You're like, why do they care about this? And then you find out their cousin or their brother. Like, we have people who care about, like, one of the biggest things that I've noticed people, and it is a bipartisan issue in Springfield, is people with developmental disabilities. It's because they all know somebody. They all have a family member who have needed these services, or they know somebody who is working in home health, or someone who is staying at home with their child who may need additional care. And so it is finding out what is that thing that they care about. So in my job, like for instance, one of the things that I worked on this year is around homeless education and making sure that students who are experiencing homelessness, that at the state level, we are taking responsibility for those students, because we don't know what Linda McMahon, the chairwoman of the WWE Federation, or World Wrestling Federation, we don't know what she's going to do with homeless education. So as a state, we need to decide what we're going to do. And so one of the things I did is, for every member of our education committee, I got them the numbers on the number of students who were experiencing homelessness in their school district. And I broke it down by school and percentages. And it is not a Black issue. It is not a Chicago issue. It's not a suburban issue. It is a statewide issue. And the representative who wants to dismantle the Department of Education the most, when I looked at his numbers, you don't want to do that, sir. You do not want to do that in terms of the number of students in your district who are experiencing this as an issue. And so these are his neighbors. These are the people that he cares about. Here's your numbers. And he came back and he asked me follow-up questions. And I said, oh, got him. Sorry. I should. And so when members from the other side of the aisle asked me follow-up question, I said, oh, you're invested in this. And that's, you care about the teachers in your district. You care about the football program in your district. Let's talk now. Sorry.
Thank you. No, that's perfect. And I hear you talking about meeting people where they're at and moving the needle.
Yeah.
Not expecting that they're going to become different people.
Okay, absolutely not. Like, no, it is hard for any of us to change. Like, whether it is because of our backgrounds, how we grew up, the news, that people who watch Fox News, do you know that their TVs are so loud? I was talking to a legislator and they're like, he goes into his in-laws house and he says that he's like, Fox News must like turn up their volume because it's so loud. And they are indoctrinated every day with that stuff. So I don't think that as my first year, someone said I was a random woman from a random charity in Chicago. I don't think that I will always like Kool-Aid man and come out and be able to like tell them that like they are going to like they are now, you know, going to be, you know, Democrats or anything of the sort. But I do think that there are ways for us to move people to the middle. And it's literally finding out what people care about. So we have a farmer who is a member of the General Assembly, and he's a nice guy. And you know, he's a Republican, and I know that this is impacting him. And it is hard for him to have to walk the party line while his livelihood is at risk. And so they don't make but so much in Springfield. And so how do you get to him, and how do you get him to talk to the rest of the members of his party?
Bob, go ahead.
Yeah, so the food stamp cutback,
Yeah.
so there was a one-time payment of $70 million.
Yes.
So the Food Depository and Feeding Illinois said to pay the federal SNAP cutbacks would it be permanent. So what happens next year?
What happens next after the $70 million in the Illinois budget for food assistance? And how much is $70 million for families for food assistance?
Yeah. So as someone who likes to save money, I really throw the $1 million amount around like it is nothing. Like I go to Springfield and I'm like, oh my God, I'm only asking for $5 million. And then I take the train because I don't want to pay $10 to get a lift. So I understand the difference in those two like ways of thinking. I think in once you put money into the budget for something, once a line item has been established, one thing I have found out, it is really hard to walk it back. And so we set it at the ask this year we asked for 150 million and we got 70. The goal is next year to build upon that. It is for the state to find a way to put additional money into it. And one thing that you said was these cuts are forever. I cannot think like that. I have to think that if the Democrats at the federal level are able to take the House and the Senate back, and then we see what happens in 2028, I hope, and maybe hope is looking at that man over there in those photos, hope that we can get back to where what HR 1 did, we can move it back. Now, I've talked to people who said that this was great for Democrats because they can campaign on it, and then when they get back and they can say, oh, we can't do it. Like we actually needed those cuts, and it's good that the Republicans did it and we didn't have to do it. And so our job is going to remind Democrats, or I should say all of our legislators, that we want HR 1 repealed. We want all of those changes that happen, and so that the state isn't on the line for all of this making sure that these folks can eat, and the fact that they are now charging us as a state around some of these things. So we have to pay the federal government. If our payment error rate is a certain amount, we owe the federal government amount. Or the taxation that we had in terms of the hospital tax, that we can roll all of those things back. We have to hold them accountable to roll HR 1 back.
Well, just thinking of the state.
Yeah.
So you get the retail merchants group was
Yes.
supportive, and that surprised the Republicans.
Yes.
So when you go back next year, are you going to take a look at the largest grocer is Walmart?
Yes.
And
Yes.
like 25% of their revenue comes from food stamps.
Yeah.
But I also understand that something like a quarter of their employees
Are on the benefit. Absolutely.
So can you make that? Can you point that out?
Oh, yeah.
Push the living wage issue as a way to, are you going to be able to do doing that in the in the upcoming?
Yeah. Yes, thank you. And thank you for bringing all of these things up. And I'll repeat it back if that's okay. So is it us looking at the largest retailer in terms of Walmart, who makes up a significant amount of the food market here in the state of Illinois, as well as our corporate welfare queen, in terms of their employees being able to access those things and being able to raise the minimum wage? The last time we raised the minimum wage is at the beginning of Governor Pritzker's first administration. At that point, we had been fighting for 15 or 16 years. And by the time we got to 15, I think people were like, that may not be enough, because it was incremental in terms of like it went up to like 13.25 and then 14 and then it got to 15. And people think that we need to be thinking further. We need to be thinking about 20. And I think that campaign is getting off the ground. I think a lot of our unions are going to be working on that. And with our unions working on that, they are also a part of these groups that we work with, because unfortunately, when you think of home health aides, when you think of people who are working as CNAs or people who are working in service of others in healthcare and social service fields, they are often those who are paid the lowest. And so I think after this election cycle, we will see an uptick not an uptick, but we will see a rising of those unions saying, hey, we need to be thinking about 20 to 25.
Thank you. Really good question. Thank you so much. I want to we have about 7 minutes left. I'm going to go 5 minutes over because we started 5 minutes late. I hope that's okay, just in case anyone's going to something at 2:30. But I wanted to quickly bring this back to SNAP and Medicaid, and want you to give us a sense of what actually are we going to be seeing moving forward this year and next calendar year, and what can communities do to help mitigate?
Okay, so we're going to be seeing a strain. I talked about food banks or food pantries. I think we're going to be seeing a strain on our food pantry systems. And so as we are looking at ways to support them, if in an individual way, I think it is like, yeah, we can bring food to them, but I also think we should be making sure that we are doing monetary donations as well, because their money goes further than ours. When we go to the grocery store, they often buy in bulk. And so when we give monetarily, it assists that way. We are going to see more people falling off SNAP. What we haven't talked about are these horrible work requirements, and it was kind of the centerpiece of what we saw within HR1, both for SNAP and for Medicaid. With these work requirements, one thing that I will scream from the mountaintop, and I said it right before we got started, those who can work, I believe it's upwards of 75% to 80% of those who are on SNAP or on Medicaid who can work do work. It is not something that people are just sitting home on. It is not something that is survivable if you decide not to work while you are receiving SNAP or you're receiving Medicaid. And so when we're thinking about those folks who are falling off, the population that I work with, people who were experiencing homelessness used to get a waiver, because if you're experiencing homelessness, oftentimes you don't have the ability. You are simply trying to survive and get out of homelessness. And so those folks used to get a waiver. People who had chronic illnesses, people who were living with HIV or with cancer used to be able to get a waiver for work requirements. And that what we found out 3 weeks ago on June 1st, Monday, June 1st, CMS at the federal level put out a memo and said, people who are living with HIV and people with cancer will no longer be able to get a waiver for work requirements, and they will be required to work in order to maintain their Medicaid. And so at the state level, we have to find a way to fill that gap. We have to be able, and talking to Leader Gable, she said, one of the things is like, we get so much money from the federal level that we are not able to fill that gap, but we have to find a way in which to work at it. And so it is identifying populations that we can say, as a state, we are going to pick these folks up and we are not going to allow this to happen. We also have, our attorney general, and we also have other legal aid who are going to be suing the federal government, and making sure that when we sue, we typically, I think it's like 95% of the cases that have been filed, yeah, that we win. Yeah, in those cases, and so it is also, that is like holding up, making sure that our AG is filing lawsuits when applicable in certain instances. I don't think it's hyperbolic, and I'm not going to end on this, but people are going to die. Like, what is happening is our neighbors, our friends, our family, the person who works at our grocery store, the farmer who's like in rural Illinois, whose hospital closes and has a heart attack and has to be taken further away, is going to die. And it's not just vote, it is holding our folks to, like, when we do elect people, that they remember why we sent them there, but it's also helping our neighbor when we can. It is a full court press in terms of the supports that we need to do. It is also, as someone who, like I said, I'm from New Orleans, Louisiana, and my mom, I went into the voting booth when I was a kid with my mom. Like, I know the importance of voting. I don't know what happened to my brothers, because I go to look them up on the voter rolls and I'm like, what are you all doing? And it is also reaching out to our friends and family who have become apathetic or agnostic when it comes to, it doesn't matter. Making sure that they're registered and making sure that they're educating themselves in places that are red. We know that we are in a blue sea, but it's making sure those family members that we know, like that they are connected in the places that they live in, to do the right thing, because they are going to be most impacted. My family in Louisiana is going to be most impacted by what is happening at the federal level. We're living under a dome, but we know that people around us are going to be harmed. And so those are some of the things that I think about in terms of support.
Thank you so much. So I wanted to check to see if there were any last questions. I can take one more. Oh, did you ask a question already? Okay, go ahead.
I asked a question already, but this is a different one.
Okay.
I thought that last week maybe
Yes. What did Pritzker sign recently?
Oh, yeah. He's signing a lot because the session is over. But this past week, he signed some things around reproductive health and making sure that our medical records cannot be transferred to other states. And so for folks who may be seeking abortion services here in the state of Illinois, that they will not be harmed by, that attorney generals from other states like Texas and Louisiana has attempted to arrest and try a doctor in New York for providing services for someone in Louisiana. And so making sure that license plate readers, making sure that our digital medical records are not accessible to other states. He also signed our state budget, which goes into effect on the 1st. So our fiscal year here in the state of Illinois starts on July 1. And so he signed our budget as well. But there'll be a lot more that he'll be signing.
Yeah, was the pushback against the Medicaid.
He signed the budget, then
Yeah.
he signed the $700
Yeah.
million that were set aside for to mitigate the
Yeah.
people falling off of SNAP.
Doing a full court
Yeah.
press in terms of doing press on
Yeah.
that. And that was in the state budget.
That was in the state budget, and Leader Gable was a part of that as well.
Yeah.
So I'm gonna be done. Oh, do you want to answer? Yeah.
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 No, please.
Go ahead.
When is your, and come back and give us updates?
Oh, yeah.
Two, do you we also, asked you to do witness slips.
Oh, yes.
And
And let's broaden that. Let's broaden that to how can people help with Protect Our Care Illinois and Save Our SNAP?
yes, yes. I don't know if it was included on the okay, all right. So and we can send this out, but both Protect Our Care and Save Our SNAP have websites. You can sign up for updates, both for action opportunities. So this past week we did something with Senator Durbin around with Protect Our Care. So making sure that again our folks hold the line. And so whether it is a like just sending an email to our federal delegation, or it is when we're in Springfield. So we won't be back in Springfield until after the election. So we'll be there the last week of November and the first week of December, and it's called veto session, but it'll be an opportunity for us to if there are any loose ends. I don't think that the governor's planning on vetoing any bills that I have heard about, but it is an opportunity for us to just do some cleanup business. And so if you're interested in doing witness slips, Chicago Coalition to End Homelessness also, please feel free to go and join our mailing list as well. That is an opportunity for you to learn about Protect Our Care as well as the work we do around homeless and housing services. And you all do great work here. You all coming out here on a Sunday and during the summer, I just want to commend you all for coming out here and just like sitting here and listening to me babble for an hour. I really appreciate having the opportunity to come here and speak with you all and to answer your questions. I did not bring any cards with me because it's a Sunday, and I got here and I said, you didn't bring not one card. But Rachel has my information, and please always feel free to reach out to me with any questions that you have. No question is, I do believe that in Springfield there are some that are stupid, but there are no stupid questions. And I appreciate having the opportunity to have dialogue with people.
Thank you so much. Thank you, Naya.
Thank you. Thank you for having me.
Oh my gosh, and you gave up your Sunday afternoon as well. So very serious summer Sunday afternoon. Okay. Thank you all so much for coming. I do want to say July, we will not be having a policy salon meeting because it is the day of our annual meeting for the Democratic Party of Evanston. And you will be getting an email notice about that if you're interested in joining as a member and attending that annual meeting where we are elect our slate of board members, and typically just chit chat and have a good chance to have some pizza together. But in August, I already have that one scheduled, and it is Sunday, August 30th. And we will have Katie McFadden, who's an environmental advocate, and she'll be talking about data centers and the environmental impact of data centers. So please mark your calendar for that. And if you're on vacation on August 30th, please know we are recording these and they're available on our YouTube page, and we will always send the link in our newsletter after the event. So thank you again so much for coming, and hope to see you next time.